Hello. So you're getting a student. Now what? If you just learned that you'll be a clinical instructor and your reaction is, yikes, or your reaction is, okay, great, what do I need to know? This webinar has been created by the New York, New Jersey Consortia to provide guidance for new CIs, just in case mentorship is not available at your place of employment. The information in the student packet is sent by the academic program to the SCCE either through a software program the school uses, electronically, or a paper mailing. Exact, Acadaware, and PT Internship Manager are the three main software programs being used. The SCCE, or Site Coordinator for Clinical Education, is the contact for each academic program. This is a recent terminology change. Formerly, the title was Center Coordinator for Clinical Education, or CCCE. The student packet includes the level of the student, general program description, course syllabus, CPI expectations for the experience, a link to access the CPI, a link to the training for the CPI, and weekly meeting forms. Student personal information would include health insurance card, CPR certification, immunizations, information regarding HIPAA training, OSHA training, and their student affiliate profile. The student affiliate profile is an important information for the SCCE and the CI since it provides information on the student's past work experience, past clinical experience, contact information, and how they learn best. This information is sent to the SCCE and should be shared with the CI. If you have not received this, please reach out to your SCCE or contact the school. As a new CI, you should review the CPI anchor definitions and performance definitions. The academic program sets the final CPI expectations for each level of student, which you should be aware of. Being familiar with the definitions of the CPI anchors and performance definitions will assist you in accurately completing the midterm and final CPI. The clinical education manual would contain the syllabus, additional assignments required by the school, such as an in-service, school policies and procedures, including absences, dress code, program expectations, CPI expectations, and post-clinical experience paperwork. What do I need to do to prepare? Continued. Find out the name of the Director of Clinical Education and their administrative assistant. Email and phone numbers if you need so that you can contact them. In addition, you might think about what materials you would want to have the student review before starting this experience. For example, lab values, special tests, standardized outcome measures, or articles that may be relevant for a specific population. And what would you like the student to walk away with at the end of this clinical experience? This should be a discussion with the student and can be addressed by setting up weekly goals. They can be written, which are more formalized. The academic program may have a form to use, or some institutions have their own forms. Goals can also be verbalized, which would of course be more informal. Students typically create these goals and then share with the CI. The CI may have additional suggestions. These are reviewed at the end of the week and new goals are set. Consider your caseload, simple versus complex patients, and the level of the student when setting goals. What do I need to know to prepare for a student? One question might be, how do you work with people who learn differently? Some programs administer a learning style inventory and therefore should know how they learn best. If not, there are learning inventories online that are quick and easy. This information is useful to know as you begin to prepare for the student's experience. Students often identify as visual, tactile, or auditory learners, or some students learn by doing. Others learn by reading and reviewing first, then a demonstration, and then doing. Another question might be, what is your teaching style? Do you like to review what the student knows, or do you want to observe and see what the student knows and then find that teachable moment? Do you prefer to demonstrate? Do you like to be the patient and your student practices on you first? And finally, when supervising, do you like to hover over the student, especially in the beginning, and then pull back? Or do you like to give them room and be readily available if needed? How this fits into the day experience will be a good predictor of success. The academic program informs students that there could be a flexible schedule. That is, long days mixed with short days, a 4-day work week, or even a 3-day work week. Do you work weekends? Students are told to follow the work schedule of their instructor. The next module talks about the student's first day.